So it is especially gratifying for me today to be part of a ribbon cutting for those that are in the medical community, because as many of you know, when I'm not mayor, the job that brought me to East Brunswick and still keeps me here primarily is that of a physician. And to see the physicians groups grow here in this community, to see the medical mile, which we have dubbed as Cranberry Road, grow, is again especially gratifying. Not that I am happy that cancer care is growing, but the need and the ability to service of the community, it still exists, and that you're growing and continuing to provide a service to the community that we desperately need couldn't make me happier. So what I was going to ask is for Dr. Salwitz, a good and longtime friend, to talk a little bit about Astera, how you've grown over the years, where your new location is, and the type of services that you're providing now that might be different than folks remembered when you first started here so many years ago.
So Astera is a statewide cancer network. We provide cancer care from the north to practically southern border. And this is our newest office right here and our flagship office in East Brunswick. Yeah, and cancer care has changed so much in the last few years with new advances in molecular medicine, biological medicine, the ability to treat and help patients survive that much longer and to cure so many more. So it's an incredible revolutionary time. But I think one of the most critical things for this office is that for the doctors, for the staff, for the nurses of Astera, our greatest honor in life is not only to take care of patients, but to take care of our community, to take care of our friends, our families, the people just down the street. And this office represents that commitment to the people of this community, not only to take care of them, to make them more healthy, to build, to provide jobs, and to participate in the growth of what is a remarkable town and a remarkable county and a remarkable state. So we're extraordinarily excited to be here to do this at this time, and it's a wonderful moment.
As a witness to history, I remember before I even went to medical school, the thought of having cancer just seemed to be, you're done. And the changes that I've seen in my lifetime and yours is that there's hope. And I think that that's the message that we need to bring to the public, is that there's hope in people who may find themselves in the most desperate of times. And that hope, they don't need to travel to the city. They don't need to travel across the country, that they have that right in here in their backyard. And that's the greatest gift that you can give to folks who are in that position, is hope.
Congratulations and welcome back, or welcome again. We are so proud to have you here. As the mayor said, the Miracle Mile, you are all part of that miracle, and we welcome you.
I'm really excited for this practice and this new facility. I am a patient here, and I've been under excellent care for over a decade with this group now. And I'm so excited about this new location. And I'm so glad you chose to stay in East Brunswick and continue to do what you do for us.
I'm so glad the fact that you all stayed in East Brunswick. You know, you could have chose to go anywhere else, but you decided to stay in East Brunswick, and that's what is really most important, because East Brunswick is the hub, as you know, the center of New Jersey. So for easy care for your patients, easy access for your patients, I'm glad that you're all here, taking care of the folks that need to be taken care of, and thank you for everything you do for the community.
Well, welcome back. It really is such an important part of East Brunswick's business community, the Medical Mile, and the medical community whole. So the fact that you've chosen to stay here and grow is something that we hold dear. And I think the commitment that you have given to this town over the last however many decades that you guys have been here really shows, I think, the commitment you have to patients and to healthcare.